that are with us, and I am super excited uh, to welcome our panel to the stage today, and we're gonna kick this discussion off. And let me prompt them all to come to the stage, and we will get this started. And I guess first I gotta stop sharing there so I can see your smiling faces. All right. Um, Thank you all for making it here today. I always look forward to these aging life care discussions because I the insights that you share and the questions that our community members offer. So what we do first is let's get to know the three of you. So Kate, I'll start with you. Kate, tell us a little bit about your background and what got you into this profession.
Hi, Steve, and everybody. Thanks for having me. And I am Kate Granigan. I'm the CEO of Life Care Advocates, which is a aging life care practice in Newton, Massachusetts. I am, by training, I'm a clinical social worker. I'm an LICSW, and I got into the field of aging about 26 years ago now, basically by accident. I was trained in education undergrad and a master's in social work, and then worked with families in their home setting, and shifted and took a job as a visiting nurse association social worker, and found that to be very rewarding, but was very limited by the opportunities I had to work with the client past what Medicare would cover. And so I began a practice in aging life care and moved through the profession. And really now can't imagine doing anything else. So
I
I feel
love it.
really lucky to be here.
Excellent. Well, on my little Brady Bunch screen here, I've got
Mhm.
Victor next. Victor, tell us a little bit about your background.
Yeah, thanks so much for having me today, Steve. Just an honor to be here. Victor Alcala, I'm a aging life care manager. My training was also in social work and gerontology. I have two master's degrees from University of Southern California. And I actually started as a family caregiver. I started taking care of my grandfather after he had a stroke, took care of him for 2 years, and was the most valuable training of my life. Got a lot of experience there. Really understood what it took to take care of somebody, and then started working in the field about 25 years ago. I can't believe it's been that long already. It seems like just yesterday. Worked a little bit in private duty home care and hospice, and worked with a couple different conservators as their case manager, and then started off in care management about 14 years ago now, and thrilled to be here. I finally found what I wanted to do when I grew up. So
I tell you, that's I've been doing these monthly discussions with your profession for about a year, and that's one of the common themes that I think I hear from everybody is that you've really found your sweet spot. And Ellen, tell us a little bit about your background and what led you to this profession.
Thanks, Steve. Good afternoon, everyone. I'm Ellen Platt with the Option Group. We are an organization located in Hunt Valley, Maryland, and we provide services in Maryland, Delaware, Pennsylvania, and DC. We have a great team of nurses and social workers. My background is physical medicine and rehabilitation, and I've been doing case management prior to this in the world of catastrophic injuries, traumatic brain injuries, and spinal cord injuries, and just realized that there was a real need for families who are aging to figure out how do we navigate, what kind of services are available for us, and people really were needing help and guidance and direction in that world.
Great. Okay. Um, okay, the next thing that I usually do in these discussions is because we always have people that tune into these that have never heard about this profession of aging life care. Kate, do you want to take a crack at a definition
Sure.
and helping people understand that?
Sure, I'd be happy to. So, an aging life care professional is someone with a background in health and human service. You heard from us, very often social work, nursing, physical or occupational therapy. Ellen has a slightly different background, but there's, in general, it's people in the health and human service field who have additional training and certification that allows us to work in the aging life care field. We are, professionals that are consultants for older adults and their families or those with a disability. And we act as advocates, consultants. We do a lot of work with families and family systems as well. And ideally, folks are finding us as they're beginning to travel the path of aging, either themselves or with a loved one, to navigate what Ellen has noted is often a very challenging and disjointed and overwhelming system. And we look at that, we take, a client-centered, strength-based, holistic approach with our clients and their families.
And Kate, before we move into the discussion, let me share on the screen the 8 knowledge areas.
Sure.
Maybe you could kind of walk through what this means to the profession.
Yeah, so this is a great visual, I think, to really understand exactly how much information an aging life care professional brings to the table when working with a client and their family. So we really are looking and have expertise in all of these areas, which include understanding housing options and living arrangements, understanding the financial piece to that. What does it cost to age? What's covered by insurance? What isn't? Understanding health and disability. We need to understand the typical aging process and understand what isn't normal aging, and all of the diagnoses or challenges that someone might be faced with as they age. We obviously are involved, and we were talking a little bit earlier as we were waiting to come on, in crisis intervention. A lot of folks don't find us until they're in the midst of a very, difficult crisis and reach out to an aging life care professional to navigate that. We need understanding in the legal field of, not just trust and estates and those things, but we need to understand the ideas around things, elder law, for instance, guardianship, powers of attorney, healthcare proxies, and the importance of those things so we can help guide our families to the right resources. And then, of course, we work as advocates for our clients in all of these spaces to make sure that their needs are being met and that they are getting what they are entitled to, and really often in times of crisis, helping to make sure that they're getting, that there's an advocate by their side. And then also, as you put up the website, we're a local resource. We're boots on the ground where the older person lives. And that's important because we know intimately the areas that, the resources. And I think I will just, sort of as a important note, we are hired by the client and work for the client only. As an aging life care professional, we abide by our standards of practice and codes of ethics, which really stands us apart in the field of aging. We do not take referral fees. We are making recommendations solely based on both a clinical needs assessment and then by the resources that match all of those areas. We are not legally trained. We're not financial planners. But our need is to understand those things so we can make the appropriate referrals to the other professionals that are on the care team.
All right. Wow. Very thorough overview. Victor, Ellen, anything to add to that?
I think she did a beautiful job explaining it. Thank you, Kate.
And
I do happen to be the past president from last year of 2024. So you do get to pretty much breathe and eat this stuff. Yeah. Not only doing it.
Now, and then Kate, your practice is in the Boston area in Massachusetts.
Yeah. We're in Massachusetts. We cover all of Massachusetts and Southern New Hampshire.
Okay. And then Victor, your practice covers what region?
I'm in LA County. I'm in specifically in the San Gabriel Valley, kind of near Pasadena, near the Rose Bowl.
And then Ellen, you stated the regions that you serve, but if you can do that again, that would be great.
Yeah, we're based in Hunt Valley, Maryland. It's just about a half hour north of Baltimore, but we provide services in Maryland, Delaware, Pennsylvania, in the southeastern quadrant. and in DC.
Okay. And now just my last housekeeping before we break into the discussion, but um if you're listening to this and you are not in those regions, or you're even if you're in those regions and you want to interview and talk to aging life care managers, there's a real easy tool. You go to aginglifecare.org, you click on find an aging life care expert, and they've got a great search engine here. You can type in your zip code and it will pull up a list of the aging life care managers in and whatever jurisdiction. I've got it set here to 15 miles around the zip code that I just popped in. And you see there's lots. So you can reach out with them, you can learn more about them. And so even though we've got three aging life care managers today from three distinct regions, they are all over the country. And these three can help you find the ones in your backyard or your loved one's backyard. Okay, so let's get into the details of our discussion. I'll just go in the same order that I went for the intro. So Victor, what's on your mind? Like what are some things that you can share with us that will get us to better understand your profession, but also might help us be better caregivers or planners or what have you?
Yeah, thanks for that. A lot of families end up coming to us really in the state of crisis. There's been some sort of change, some sort of a physical change or some sort of a social connection change. A lot of times families will reach out to us maybe after a spouse has died who was the main caregiver. I just had a client reach out to me last week. The family actually reached out to me, and it's a blended family. They were in crisis. Their father fell three times in the last week, struggling with some type of dementia, and they've been really leaning on his spouse to do something for the last probably year and a half. So it's so interesting because there was a little bit of kind of tension, like, oh, she should have done this sooner. She should have made a change sooner. But one of my favorite things is nothing changes if nothing changes, and if it doesn't need to change, well, then things just kind of go along, and people just kind of try to figure stuff out. But they had reached out to me because their dad was in the hospital at the time, was on the verge of getting discharged. They didn't know what to do, what sort of support he was going to need. Suddenly he went from being very physically fit and athletic to not being able to walk. So they were really struggling trying to figure out what do we do. And as a blended family, there was also a lot of different perspectives that were at play. So they needed somebody to be able to go in and figure out kind of what the different perspectives were and how to kind of sew them together to be a unified plan. So I was able to get out there. I was able to get out to the hospital the following morning. Met with the client, met with the husband, the wife. Phone calls throughout the day with the various family members, kind of far flung, and started to cobble together a bit of a plan for them, and reached out to a trusted memory care facility that I've used many times, and has always exceeded my expectations. So I knew they would end up being helpful and would be able to move on this really quickly. So we got them moved, and nothing goes exactly as planned all of the time. So there was also a lot of wrinkles to iron out over the course of the last few days, and woke up this morning thinking, okay, I think we're starting to settle down and get a little bit of a plan, and everybody's starting to have a lot more trust in me and my skills. I think I've been a really good resource for his wife, who's really struggling with all of the changes that she's seeing. So, I know my role is as coordinator and resource finder, but for her, it's also as confidant, as really giving her some place to be able to go to with all of these feelings that she's having of all of the changes. And, she was his primary caregiver. So,
Mhm.
in a way, she starts to feel like, wait a minute, now, what's my job now? What am I supposed to be doing? I'm supposed to just turn him over to a bunch of strangers. So yeah, so it's been a challenge, but it's been
Wow.
a really fun case to be able to work on.
Man, thanks so much for sharing that case because it just there's so many little rabbit holes that we could dive down on that. But I think the thing that I'm really glad that you shared because it's what I've seen personally where um, when there's many family members involved, like there's the two extremes. There's when it's just one caregiver or no caregivers, no family involved. But then in your case, especially the blended family, all these different perspectives, I just feel for the wife, the amount of pressure that she must be feeling for being the caregiver, but then everybody talking in her ear and the value that an aging life care manager brings to that in terms of you're advocating for the client, as Kate had said, and what's best for the client, and sort of being an interpreter to all the noise that's going on.
Yep, yep, that's exactly right. The really being an interpreter is the best way to put it.
Mhm.
There's multiple opinions that are coming at her fast, and especially with him being discharged from the hospital within probably 36 hours of me getting that initial phone call. I was able to work with her and really start to distill it down to a couple of basics. We're either going option A or we're going option B. Everything else we'll get to eventually, but right now it's just these two choices that we're looking at. And I think it was really helpful for her to see it that
Man.
way.
Well, before I move to Ellen, Kate and Ellen, any sort of thoughts or riffs on the case that Victor shared with us?
Well, just to add on what you were just talking about is I see that a great place for a care manager is in the midst of those family dynamics. A lot of times they're well intended, but there's a push and pull and a tension between what everybody's trying to do. And a lot of times that a care manager comes in, we're the objective sounding board, but I think a really large part of our job is just education for family members. And we can kind of educate everybody to the same level, then we're talking the same language. And I think that's a big issue when you get a lot of people trying to do what they think is right, but not really knowing.
I love it.
Yeah, I would
Um,
agree. It's just, I think being able to be an objective professional without the emotional connection to the choices, but really being able to sort of hold everybody's space so that they can come to what is the best possible choice with the challenges they're facing. I
yeah.
agree.
No, this is great. And Victor, I got a few things that we'll circle back on that I wanted to bring up if our audience members don't bring them up. Let me Ellen, what's on your mind, and then I'll go to Kate, and then folks keep on writing these great questions in chat. We'll go through and we'll share some perspectives from each of our panel members, and then we're just going to focus on your questions. But Ellen, what would you like to share? What's on your mind these days?
Well, I had a case study that I thought would really highlight what care managers do. I had gotten a call from an attorney that I had worked with for a number of years. He got a call about a Jane Doe that was in the hospital. And it was just somebody that was kind of walking in the street. Turned out she was about 2 blocks from her house, but didn't know it. Very confused, very disheveled. Took her off to the hospital. And somehow they figured out that this attorney had done her planning documents about 20 years before. She didn't have a spouse. She didn't have any. Her son actually passed about 10 years before this.
Mm.
And she was really alone living in a house. So nobody was picking up the signs. Nobody was realizing that she had dementia. And so they found out this attorney He was willing to be the guardian, but he didn't know the clinical piece. He didn't know, what does she even need? I mean, obviously she has cognitive issues, but what else does she need? So we were able to work with the hospital discharge staff. We were able to find a memory care facility, which was most appropriate for her, near some people that she did know. And then we were involved in just helping wrapping up her house and getting it ready for sale and all the stuff that goes along with that. But as I was with the attorney and trying to wrap that up, you could see all the telltale signs in the house. You could see the expired food. You could see the dings on her car. You could see, just bills piling up, and her hygiene was bad, and just those kinds of things. And there wasn't anybody, unfortunately, to see the telltale signs. And it had just progressed to the point where she was so confused, she got lost taking a walk and ended up in the hospital. But the good news is we got her into a memory care facility that had a lot of engaging activities. She was an artist, so we were able to bring in art activities and things for her. Mm-hmm. And I saw her every week for about 3 years until she passed, provided the things that she needed from the outside, toiletries or quality of life items that she just liked, ice cream that she preferred, things like that. And then, was there when she had a funeral. And unfortunately, she didn't have many people there, so we were able to be there for her all the way through to the end.
Wow. That's another great case, building on the one that Victor shared. But one of the things that you said right out in the beginning was that this was a case where you were working with an elder law attorney. I've heard on these previous discussions that elder law attorneys and aging life care managers work hand in hand often. Can any or all of you elaborate a little bit on what that relationship kind of looks like?
Yeah, I'll just say I'm sure that the others would have the same experience. Those are often the people who are trusted advisors to, the folks working with. And so they will, because of our understanding of each other's roles, we're often the person that they will look to help complement the work they're doing or inform the work they're doing. In some cases, people are seeing an attorney and they're suggesting an aging life care professional to help navigate these things and make decisions. And then the attorney will work on the legal side of that, or we may meet with clients who have never yet made any, connection to get those important documents completed. And so with that, we're often making a recommendation along with the other areas that we're looking at to help them find a professional that will help guide those decisions and in important pieces of the puzzle for older adults.
I love it. All right, folks, keep the questions coming in. We're going to get to them, but I want to give Kate the opportunity to share her perspective for this discussion. Kate, what's on your mind today?
Yeah. Sure. Well, I echo both what Victor and Ellen have said in terms of the ways that we've worked with clients. I've been in the field over 27 years, almost 28 years. And so I've seen an evolution in our practice in that a majority of people were finding us sometimes, through the professionals, advisors, and they were coming to us when they were up against a crisis, as both Victor and Ellen noted. And we were certainly certainly do still help families every day navigate those complex crises that they're in, sometimes in a very short order without a lot of opportunities or ideas of what to do. But an evolution in our industry that I've seen and noted with colleagues across the country is that we are finding more and more that we are getting clients in a planning perspective. These are our proactive, we call them in our practice, our planning clients. And it's such a wonderful opportunity to help people while they have choices and options. And, we talk about the fact that very often when people come to us in crises, yes, we can help them with those decisions, but the options often narrow because we've already surpassed, different avenues that they could look at. But when we're working with somebody in a proactive way, we're coming to the table with a wide variety of options that they're directing. They're getting choices because they're not in the trenches with, we have to go in this direction. Staying home is no longer an option. I'm not able to afford or take care of myself. These are folks coming to us, oftentimes, and we've had clients that have come to us as in a crisis with their older family members, and then the couple comes to us and says, "We're not going to do it that way. We are going to have a plan," and we then become their sort of planning, partner. And we are then working with an elder law attorney or getting them in touch with an estate, or elder law attorney, helping them find a financial planner if they don't have one, and then collaborating with all of those professionals to ensure that they're, understanding their unique wishes and goals. Where do they want to live? What are their, must-haves, and what are the non-negotiables? What does that mean financially? And really helping walk them down a path. And as you said, helping them become an educated consumer. I like to tell people it's better to be, to age by intention rather than default. And so proactive planning really allows that to happen. And the solo agers are a huge population of folks who, really it's almost more imperative than others, because they don't have the luxury very often of, that spouse or child that are going to be their automatic organic support system. So they really need to build one. And then our planning helps them do that.
Yeah, no, I have seen this trend too, and it's really, to me, it's very exciting. I think
Mm-hmm.
a lot of times the people that identify as solo agers, it's they feel like, oh geez, I don't have that support, but they're, especially when they reach out to an aging life care manager to do some planning, they're more empowered than the husband and wife with 5 kids who are just, oh, somebody will take care of me.
Yeah.
And I love this trend, and I hope it continues for sure. Okay, we got tons of questions here. I'm going to try to be fair to everybody and answer them in the sequence that I saw them come in. And Alyssa is well, oh no, Joe was first on the list today. He said, what are some of the what is the primary goal of a life care manager, and what are some of the roadblocks? I know you all talked a little bit about that, but if anything else comes to mind, that would be great.
Yeah, I'll jump in here, Steve. So the primary goal of us as care managers, for myself, is really to increase the quality of life that the person is having. And there's obviously a lot of different things that go into that. But it really starts with, okay, are we taking care of their basic needs? Or, they have a roof over their head? Do they have, food and clothing? Is their medical care getting taken care of? Are they getting all their needs met from a healthcare standpoint? What do they like to do? How do they prefer to spend their time? Is there some sort of way that we can introduce a service or an activity or an organization to them that really helps them to meet those higher level needs of, I want to enjoy my life. I want to be able to have fun. So for me, it really starts off with the basic building blocks, food, clothing, shelter, medical needs, and then the kind of capstone is quality of life and making sure they're actually enjoying the life that they have.
And Joe, we talked earlier in the specific case that Victor brought up about the roadblock is sometimes the roadblock is the people that actually love the client that you're serving, the family that is Monday morning quarterbacking.
Yep.
Very true. I would agree, Victor, perfectly put. I think what we often say is, if someone is looking for assistance, guidance, it's really the beauty of our role is that we are not restricted in how we help. We're very, very creative, and we can think outside the box. And, other than really following our code of ethics and practice standards of practice for excellence, we have the ability outside of what other case managers in a hospital or the insurance company person and case manager or the skilled nursing facility social worker. They're bound by their roles. And I say when they walk out the door, that social worker that might have felt great and supportive is no longer accessible. So we travel through their world, wherever that is, and don't have that limitation. So, we really have a flexibility to listen uniquely to each client and meet them where they are and help meet those needs and improve their lives.
Yeah, well said, Kate. That's one of the things that we see. A lot of times people think, there's right or wrong. And a lot of times it really is, what's your goal? You could do it in two different scenarios. But when we're looking at, finances and what their goals are and what their preferences are, that might steer. But, again, our role is to educate so that they're making informed decisions and they're not making a knee-jerk reaction at the time of a crisis. So we want them to have options. We want them to function as well as they can, as safely as they can, in the comfort of the location they choose. And a lot of times there are ways to do that, but you have to do that planning.
I love it. Now, Ellen, this next question from Alyssa, it says, are there any age restrictions for people who may receive assistance? I'm not sure about the other two panel members, but I know your practice serves children as well, doesn't it?
It does. We've added children, providing services to children over the last probably 3-4 years because we were being asked by the families. It's the same skill set. We might be navigating different systems or have a different payment source, but we were getting calls from aging parents who had adult children with disabilities and they needed navigation. So we've always done that, but we were just getting them younger and younger, where they needed somebody to go to the IEP meetings in school and advocate for technology and services, or if they needed medical care due to a disability or some type of chronic disease, we were able to be an advocate for them and help the families understand the choices and the options and guide the decisions for care.
Wow, this is great. Kate and Victor, any with your practices, are you mainly dealing with the older adults and their families, or have you seen any different demographics?
Yeah, I will just say we do primarily focus on older adults. There are a lot of practices that vary, as Ellen said, and I think the key is, do we have expertise to serve this client? So we do not discriminate, if you will, with a number. We want to make sure our skill set is a match, and if not, make a referral that fits. We, as Ellen said, we don't want to end up in a situation where we don't have a knowledge base of a system that they need to access. And so we evaluate based on, we have a lot of younger clients. We have a strong mental health background and experience. So we have a lot of younger clients that also have, some significant mental illness, but again, our skill sets and knowledge base a match. And that's really how we determine.
I love it. All right. Now, let's see. This is a good question that I've never had before from Alex. He says, how might an independent pharmacy better cater to aging life care managers? And you guys could give Alex some specific answers there, but for all the vendors that are out there too, what's the best way to work with y'all?
Mm-hmm.
For me,
yeah. No, I just want to make sure we mentioned the corporate partner. I'm putting on my aging life care member hat. So, but Victor, answer the question, and then I'll do a plug for that.
Yeah. So for me, in terms of vendors or different organizations that are serving me and my clients, number one is good communication. If I find out from the client that there's a problem and you didn't come to me with the problem first, we're gonna have a talk. We're gonna have a talk. I need to make sure that you are Johnny on the spot with getting me information that I need to know, so that way I can then turn around to the client and say, okay, we had an issue. This is how we fixed it. And now we don't have an issue anymore, but just to make you aware that there was a potential problem. So for me, it's really good, solid communication.
Right. And I would echo that. I think we all want to work with, we are not getting a referral fee. We are not having an investment in any other reason to work with an associated service other than it's meeting our clients' needs, and it's excellent. Clients are looking for us to, swim through the pool of resources that are very confusing, not well defined, often, very misrepresented or understood, and helping them know what the services are, how are they paid for, and how to choose excellence. And then, as Victor said, if people are working with us and our team, we expect them to be excellent communicators. We are humans serving humans, so nothing is perfect. The only imperfect thing is not addressing issues in a prompt way that's respectful to my client. As far as pharmacies, they are a huge resource for all of us. I would suggest that you check out the Aging Life Care Association website and note that there is a section for corporate partners. So these are folks who are not acting as aging life care professionals and aren't trained in, but they're ancillary or support services that our clients and that we as aging life care professionals need to use and refer to. And so they follow they have the code of ethics and standard of practice as well. And they join the association so that we can all work closely and collaborate. And I would recommend you look and see if that's a fit for you as a vendor to our association and our members.
And I dropped the link to that page.
Thank you.
Chat there. Okay. I always wait for this question to be asked, and it's how are your fees determined? And I bet you, Kate, because you've been on top of the organization for so long, you probably got a good answer to this.
Yeah, I can answer that quickly. It depends. The fees of aging life care professionals vary across the country, size of practice. There are nonprofit and for-profit organizations. You have solo practices, or you have practices with 20 or 30 employees. What I would tell you is if you go on the website, you will see our code of ethics and standards of practice. You should know prior to signing up very clearly what the fees are and for what service, how they're determined, and what we charge for. That is part of our duty to you as a client to make sure that you understand our fees and that we are being very clear. I believe, I would suggest have a fee agreement that you review and sign, so that it is clear and that we're all starting from a place of understanding as then we begin our journey at working with you. I would tell you, people usually ask a range, and I would tell you that I think recently our ranges would be somewhere in the arena across the country of 100 to 125 or 50, all the way up to $300 or $400 an hour. We typically bill it by the hour, but many practices also have a flat fee scale for various services. So the key isn't that there's anything specific. It's more about understanding and having that conversation and feeling very comfortable and clear prior to any work beginning.
Great. Okay. I'm going to paraphrase Barbara's question on aging in place, but she's in Maryland where Ellen serves, and she's curious about the trends in aging in place. The continuing care and life plan communities are so expensive, and talking about aging in place will be the only option. And if there's any government support or what have you, maybe just talking about, like, I imagine that you have families and individuals that come to you that are sort of torn between aging in place, making a move, and then also dealing with affordability. What are some of the ways that the profession can help folks sort through that?
Yeah, a lot of it is again, that education, because you hear all these different terms: memory care, assisted living, respite, hospice, and it gets really confusing. People say nursing home, and that could be anything, but really skilled nursing is very different than independent living or assisted living. So you hear these jumble of words and it's hard to understand. So first off is educating, knowing where the payment would come from, whether it's a private pay scenario, whether there are large upfront fees like the continuing care retirement communities where everything is one campus. You stay there, come in at the independent living level and stay until end of life. But some long-term care facilities do accept Medicaid. So when you get to a certain threshold, Medicaid will pay for your long-term care. So again, it's just educating on those options. The good news is there are lots of ways to extend your ability to live at home. And a lot of people want to stay at home, and that tends to be a less expensive option, depending on how much care you need. But there are lots of ways to stay at home. There's lots of ways to be creative and extend your ability. There's some things in the community like adult day that can allow you to have care during the day, maybe less expensive than in-home care. There's lots of options. So it's just figuring out, again, what's the best option for you. Maybe looking into the village concept that's out in the community that allows people to stay at home. So there's lots of ways to be creative and again, just weighing the options and seeing what makes the most sense in this scenario.
And I'll just jump in quickly with because I saw some of the question is, what is covered, what's not covered, state agencies. There is that one of the great resources is start with the Council on Aging in your town. Every town has a Council on Aging, and they typically have someone there that can walk you through where to turn, what's covered, what you might be entitled to. It's a free resource. And I would just say it's a great place to start if you don't know where to start. An aging life care professional can certainly do some of these things for you, but if funding is an issue to start with, it might not be the right place to start. But I would tell you that we work with people who have a wide variety, and I bet all of you do, of income and finance options. And so it may be, but yet things are expensive, and aging is expensive, moving is expensive. And so getting some assistance in just as Ellen said, in consultation with your unique situation can put you on a path of understanding. And I would suggest that would be money well spent.
Okay, this is great. Now, this always happens, and I love having this platform because we have people that tune in that are in crisis situations. And if we can just give any sort of glimpse of hope or guidance, that's great. So Cheryl says, I'm permanently disabled. My family left me as the caregiver for my 89-year-old mom. I'm having challenges getting through various tasks. Where should I begin? My mom has not completed her health directives or power of attorney. Now she has trouble writing. What do you recommend I do to get these documents completed while she's in the nursing and rehab center? And she goes on to say that she has bills that need to be paid and we can't access her banking. So I know we don't have the magic wand for Cheryl, but any words of encouragement or first places to step that you have when you have clients that are in these situations?
Victor, I don't know. I'm happy to.
Okay.
Yeah, I mean, I think I just mentioned one, but if she is currently in a rehab, that's a place to start. If she needs an assessment for competency, unfortunately, sometimes that's where you need to pull in or have them help you. There is should be a discharge plan or a social worker there, and I would begin a dialogue about how to get these documents done. If she doesn't have any of those documents done and she isn't unfortunately able to make her own decisions in her healthcare, there may be a need for guardianship. There may be a need for bringing in elder services from there are federal funding and services that you and she may qualify to gain assistance. So I would really start talking about where your challenges are, being very honest about the difficulty in bringing her home or accessing funding and help, and then hopefully looking at entitlement programs that would assist you both.
So if she can't communicate and fill out that paperwork, then going through the guardian process. And I think great point is that the social worker in that nursing home should be a good first place to start.
Yes, a free resource. They want to help make sure she gets, quite frankly, their job is to get her discharged. And until she has a safe discharge and you have a plan, they should be helping you address those things.
Okay, great.
And I will say, should is probably the
Yes.
primary word there, one of the most important words. I a lot of times I end up families end up bringing me in this exact same situation. How do we get all of this done? And I'll say, well, talk to the social worker there, and the answer is, I have. They're not very helpful. And a big part of it really, kind of to pull back the curtain a little bit, a big part of it is a lot of responsibilities into getting thrown at the social worker in a care
Mhm.
facility, in a skilled nursing or rehab facility. So a lot of times it's really tough for them to be able to juggle all of that. I would also add that states kind of vary, state to state on the regulation. So here in California, if somebody's in a rehab facility, they need to go an extra step of actually having the ombudsman come in and witness any documents that they sign related to their health care. And that's really put in place to make sure that somebody isn't saying, well, they're in a really delicate situation here, so let's let them make big life-changing decisions, and they don't really know what they're talking about, but let's force them to make these decisions anyways. That ombudsman is really a layer of protection for
That's
the
a great
client
point.
or the patient, to make sure that they really do understand what it is that they're signing or looking to do.
I love it. All right, thank you. Hopefully that's helpful, Cheryl. And
Oh, Steve, can I answer the bank question real quick?
oh,
Just
absolutely.
Yeah, just real quick tip on the bank. So, uh, and I think you said that this person does not have any power of attorney or advanced healthcare directive in place. I would start with the bank. I would go to the bank, because a lot of times banks have their own documents that they require to be signed. The power of attorney is supposed to be a general document that you could use anywhere at any institution to be able
But
to say, I
this,
want this person to make decisions for me. And I have been faced with a lot of situations over the years where the bank says, that's nice, but that's not on our form, and you need to use their form. So I would honestly, I would start with the bank. Do you have any specific forms? We were going to get a general durable power of attorney done. Do you have any specific forms that we should use?
I'm glad you said that, because all of our elder law discussions and estate planning discussions say the same thing, is that we spend all this money to have the attorney do these documents, but the banks, they want their documents completed. So Cheryl, that's a good idea. If you know what bank she's at, get that form and at least bring that in, and that can get executed. Um, Okay, now this is another good question that I've never heard before. Joe asks, are you able to help folks who have pets and have reached the point where they need to go to a care community?
Yeah. Yes.
I had a year where I considered myself a geriatric cat manager instead of a geriatric care manager. We had somebody with 17 cats, and they were all expired on their shots. And so we had to catch them, quarantine them, get them care. But we've had people, there are some facilities that will allow you to bring your pet if they're, certain parameters. So sometimes we can, as part of our role, we're looking for a location for this person to move where they can take their pet with them, or bring in pet sitters to take care of them if the individual is no longer able to do that themselves. So again, we can be creative
Yes.
sometimes when we need to be.
Great. Okay.
Ditto.
Here's a good and what I've seen is, depending on the community or the healthcare facility and the demeanor of the pet, like a lot of times folks can bring
Yes.
their pets with them. I've been blown away at how many pets I see in restaurants lately. The okay, Helen, some good questions here. This is great.
Mm.
Ellen says, can you explain the options for somebody who's been released from the hospital but only has observation status, thus not able to get Medicare to cover the skilled nursing facility that they're entering? I hear about this a lot. Do any of you want to kind of share that information?
Anyone?
Yeah, I would just say yes, observation status is a really big problem. Unfortunately, my experience, and I'd be anxious to hear if either of you have anything different to say, and those I've talked to, I think this has been, we have a listserv to our association, and this is a real issue. Um, when someone goes into the hospital, the observation status is not being admitted. It's just as it sounds. And so families can be very misled because a loved one could be in the ER for 3 days, which is there needs to be 3 day stay prior to getting coverage in most healthcare, Medicare certainly, to get coverage to move to a skilled nursing rehab. And if you are not aware that your loved one, even if they're there for the counted number of days, is on observation status, you will be shocked when you're told they're not qualified for coverage. You will need to pay out of pocket.
Mm.
The sad lesson is that I've learned and is difficult is once someone leaves, and you won't learn it sometimes till they leave, and it is very very I would almost, I don't want to say we've had no success, but reversing that decision after discharge is near impossible. So knowing the status when someone goes in, advocating for admission as soon as possible, for things like this is not a, using, oftentimes older people come into the ER and it's assumed that they're like that because they're old. That is normal aging. They're confused. So being able to advocate or have an advocate talking about this is not normal, something has changed, this is a status change, a mental status change or physical change, and we need them to be admitted and worked up, and advocating for that so that you begin your countdown for your 3 stay. And then if you find that someone's been there but they are on observation status, sometimes you can advocate to have that changed if you have rationale that would fall under Medicare's coverage. So it's not an easy thing, but the first is being educated that it's an important topic, and then pushing for admission if rehab is what's probably going to be on the line. There are Medicare Advantage plans that don't, and other facilities that don't require a 3-night stay. They will direct admit, or so there are some exceptions to the rule, but it's difficult to know and find. And so I would suggest, and then the second part of that question is, do we help with specific nursing facilities? Yes. As Ellen said, we're part of our role, if it's to help find an alternative living environment from the home, is to know the nursing facilities, the ins and outs, what's covered, and all those things, their quality. And that is something we do, and we're objective because we're not being paid by or hired by the facility, we're being hired by you.
Okay, great.
Hopefully that's helpful.
I'm looking at the clock. We're right at about an hour. We still have a bunch of questions. Are you guys okay hanging on for just maybe
Yeah.
10 minutes or less? And then, folks, if you need to jump out, don't remember, this is recorded. It'll be at proaging.com later today. Okay, let's see. Paulette says, my mom, who's 85 years old, living with dementia, is under my care. I currently have a power of attorney, a bank institution paperwork, an advanced care directive in place. Am I missing other documentation? Wow, Paulette, your mom was proactive, or you were proactive, but anything else that she should have in place for her mom?
I would honestly, bravo that you're at that point. Really congratulate yourself for being that organized and that proactive. I find that in my line of work, not many come to us in a state of crisis having been that well organized. So nice work. One other thing that you may want to start talking about too are end of life decisions.
Mm-hmm.
As we go forward and as we age and we get closer to our end of life, things happen, things change and can often change very quickly. So you may want to have a conversation with, I think you said your mom, about what she would want to have happen at end of life. Across the country, each state kind of has different forms. Here in California, we use the POLST, POLST form, which is the physician's orders. So it's a physician's order, which requires a physician's signature, and also the decision maker, either you or your mom, to be able to make end of life decisions. So physician's orders for life sustaining treatment. And through that, you're able to determine if her heart stopped beating, if she stopped breathing, what would she want? Would she want somebody to try to bring her back to life. What level of care she would want? Is it really comfort focused, comfort care, keep her comfortable, keep her pain free, or do you want more aggressive types of treatments, intubation, feeding tube? The third section is actually a feeding tube or not, or trial basis. So number one, having that conversation with her so you know really what she would want if certain things were happening. And number two, if she is getting closer to end of life, putting a pulse into place, I think that would be helpful as
Great.
well.
Great. Paulette says, thank you. Also, this is great. Somebody said that they had a client in observation for 11 days at a hospital. They fought for them to change while at the hospital and they would not. And this is because the hospitals get penalized if somebody is discharged and comes back, correct?
Correct.
Okay.
I think there's a few reasons. Yeah, their level of responsibility when they're in observation status is different than an admission. And they do get dinged when people come back within, a 30-day for the same reason. It's a good reason, however, on the other side of that, to advocate for a good discharge. And a good discharge starts with a good workup. And so I think, really pushing back on that, unfortunately, my experiences getting that reversed is almost impossible. The place where you do well to bring it up is upon entrance into an ER and understand what is your process. When will they be admitted? How will I know? They're actually supposed to, legally, I believe, give you a understanding of observation and you're supposed to be discharged or admitted within a maybe 48-hour period. I don't know if both of you know. I don't know if that varies, but I think it's pretty standard that they are supposed to do that. What people are supposed to do and what actually happens, unfortunately, are often where we come in.
All right.
Yeah, and our best practice is to ask. Just it could look like they're admitted. They're in a different room and they're still coded as under observation.
Yes.
So it's really important to ask that question early on.
Yeah, because paying for skilled nursing out of pocket is really expensive.
Absolutely.
Okay. Renee, gold star for Renee. She is in the proactive stage. She says, I need an attorney for a will, a financial planner, household money management, maybe somebody to be my backup. And her question, and it just moved, was basically, do I go about finding all these people, or could I start with an aging life care manager and then you all might help her find?
Yes. The short answer is yes. Ideally, doing that on your own, although she could, would involve a lot of, guesswork or, really investigating who's a good match. An aging life care manager likely has those relationships, and many of them. And I like to say, and not everybody wants the, in Boston, the Boston skyscraper looking out over the harbor. They may want the solo practice that does house visits. So I have both of those contacts. I just need to understand what are your likes? What kind of personality you want to work with? Is it important to have a big firm, or do you really want just one person? Same with financial institutions. I saw somebody, there are fiduciaries, daily money managers. We typically, and all the things you mentioned and more, have, you may not even know there's a resource out there. You have an issue or a need, and we can say, oh, there's a professional that does that. So I think starting with someone like us that helps you navigate all the pieces, and then we can help you together put the puzzle together, make those introductions.
I love it. Okay. All right. Again, another one here from Karen that's great. Do life care managers provide feedback when selecting a nursing home? I'm finding it hard to find good reviews for these, and they seem to be biased. You can all help people find a place and then advocate for them after they've moved in.
Yes, absolutely. That's very much a part of what we do. And as to continue to remind people, we are working for you. So we're making a recommendation based on your wants, needs, likes, dislikes. And so, yes, we can help you sort through. And again, we're not necessarily, I always say, it's not like, it may not be as clear as this is a good place and this is not. It's this is a good place for you because of the needs and interests that you've told me about. This may not be for that client. And so our job is to really know you first so we can narrow down and give you some options and pros and cons. Not all places have everything. So what are your most important needs? And then how do we help choose with all of those pieces in mind? I do want to I'm going to put another, again, putting my aging life care, president's hat on, is that we also, the differentiator, there are, from a consumer's point of view, may be confusing. There are resources out there that are free to the consumer. They are what we call placement agencies, advising agencies, and they are, although it maybe have a good quality, that may work for people who don't want to hire or can't hire a professional. They are actually not unbiased. They're making recommendations because the way that they are paid in their profession is by the choice you make. They will recommend somewhere that pays them a referral fee when you choose that option. And so it's just, that's part of being a very educated consumer. And it also differentiates aging life care professionals because we do not, by our code of ethics, ever accept a referral fee for our referrals. We're doing it based on your needs and the match and the quality that we know.
That's great. Yeah, that question came up during our last session. Somebody had a question about those services. Okay. Well, I'm gonna make this our last question here. And thank folks for the great questions. I read that 70% of people over 65 need 3 years of long-term care. How can I have a conversation about this with my daughter and son? Is there a resource that you can share? A real easy question there, right?
Yeah, that's a big one. How are you going to pay for care? And that's something that ends up being surprising to a lot of families that come to us. They think, oh, well, I'm going to go to you. You're going to figure out how to get Medicare or to pay for all of these services, and are often surprised when they realize, wait, what do you mean I have to pay for it out of my own pocket? Why aren't there government services to be able to pay for this? This is a travesty. And I would agree. We need to figure out a way to be able to collectively pay for these services.
Right.
And the big part of it is because if somebody doesn't have the funds or the finances to be able to pay for it themselves, well, then somebody has to either pay for it or provide it themselves. And honestly, that's where you end up getting a lot of adult daughters leaving the workforce because they have to go and take care of mom and dad.
Yeah.
So it's a real challenge. But yes, that is a big part of the planning process is talk to your kids, talk to your family about how are we going to do this?
Right. And I would agree that I think just if that person starts with an aging life care professional as their sounding board, they can help you put together the pieces of the conversation and guide you. They can also then bring in the kids when the decisions are made or when the information is kind of compiled and collected. And often we have clients who want us then to talk with their adult children about all the things they're deciding, help them be introduced to us because they want us to be the resource for the adult children when and if something happens, so that they have the stress, sort of a less stressful concern about the pressure or responsibility they're putting on their children. But I think I always say conversations start early and talk often.
Yeah.
One of the things we haven't really mentioned too is that aging life care managers can also avoid duplication. We can help navigate their care through the benefit that they already have. Perhaps they have they're a veteran and there might be some veterans funding, or perhaps they have a long-term care insurance policy that can help pay for care. So sometimes we're able to better out whether there's some other support resources for them.
Yeah, I love it. Man, what a great discussion that we had today. I want to thank all three of you but I really want to thank our audience that always asks these crazy questions that I would never dream up, but they're so relevant. I really appreciate your time today, everybody, and we'll get this recording up with contact information for all of our panel members, the Aging Life Care Association, and any resources that we mentioned today. And really, thank you all, and look forward to seeing you all out there. And your profession is amazing.
Thank you for having us, Steve.
You
Yeah,
bet.
Steve, really
And
appreciate
thank you
you.
for everybody for your participation. It's been wonderful. Thanks again.
You too.
Take care.
All right. Talk to you soon.